The Pediatric Intensive Care Unit here at Community Regional Medical Center treats children who face life-threatening illnesses or trauma. The specially trained pediatric ICU team works side by side, complementing each other's skills, all to give their young patients the best care possible and be there when they need them the most. Today is a momentous day for 17-year-old Johnny Martinez. He gets to finally go home after spending almost 2 months in the hospital. The teen's life was almost cut short this summer when he slipped and fell into a river in Yosemite National Park. He was underwater for several minutes before he was rescued.
When we saw him first in the pediatric ICU, he had a injury to many organ systems of his body. He had difficulty breathing and his lungs were very sick because a lot of fresh water had entered into his lungs, and that had washed off all the protective barriers in his lungs, and that created a lot of problems.
Dr. Krishna Siragupa was one of Johnny's physicians in the Pediatric Intensive Care Unit.
With each organ system that gets affected, your mortality, that means the chance of death, increases exponentially. And in his case, he had at least 3 organ systems that were not functioning well: his lungs, his kidneys, and his blood. They were not working well.
Johnny had a small chance of surviving, but the dedicated PICU team worked around the clock to ensure he stayed alive. UCSF Fresno pediatric resident Bonnie Kim remembers how the entire team pulled together.
From just even having my attending, my bedside nurses, we also have dietitian, pharmacy, PT, and OT, and also child life. We have such a wide range of people and all of the consulting doctors as well for all the other organ systems. Everybody came together really to make sure that he got better.
Bonnie says Johnny was also seen by pediatric infectious disease specialists.
He did have a very complicated infection in his lungs, though. It was a very rare bacteria, that is the bacteria that lives in the fresh water, and he was drowned in the fresh water.
Johnny was on a ventilator through most of his treatment, but even then he worked with physical therapists who helped get him out of bed and walking again.
Awesome.
Johnny also bonded with many of his caregivers, like respiratory therapist Scott Gospedinich and registered nurse Garrett Partain.
Johnny was, fairly awake during most of this, even though he did have a breathing tube, but his spirits were always high. He would ask to listen to country music or put on movies and things like that.
When we have a good outcome like this, we're just, kind of makes us teary-eyed,
Yeah.
Dr. Siragupa says his whole team has a passion for treating children and helping them heal. And it's because of the amazing team effort that Johnny is alive today.
It's just not a physician or a staff nurse or anybody else. It's a team of people who cared for it. It has to be team approach with all the nurses, and also it has to be team approach with our therapists, who did an excellent job.
The young man doesn't remember much of his accident, but knows that his life was forever changed by the PICU team, and he shares his hope for the future.
Study more and more and more and more, get a job, get a house, take care of my mom and of my family,